I'm Ron Davis, and on behalf of our Board of Directors, welcome. The Vail Valley Medical Center is one of the premier assets of our community, providing excellent patient care, patient safety by a dedicated staff that has done awesome things in the last few years, as well as a team of world-class physicians that provide care to our patients in a compassionate as well as professional way. We citizens are fortunate to have such wonderful health care, and it would not be possible without all of the dedicated support of giving of their time, their resources to the Vail Valley Medical Center.
Oh, it's really cold outside. My chest really hurts.
When did that start, Walter?
It feels like a belt tightening around my chest. It really hurts.
We're going to get you moved back over to the hospital bed here, and I'll take a closer look at you. Hey, Paul, this is Walter. He's 74.
My chest.
Okay, and from a scale from 0 to 10, where is it now? How bad is it?
It would be like a 10 or 12.
Okay, we're going to get you on some oxygen. We're going to start an IV on you, and we're just going to get you checked out here. His heart rate's coming down now. Good. You still having that?
Looks like he's in a irregular.
The crash bed?
Yeah, please.
Some oxygen.
It's taking a blood pressure on you right now.
Start CPR.
Everybody clear? Shock!
Is somebody giving a time check now that we're going continuous?
Get chest X-ray and consider extubating.
Earlier this year, we started to explore using clinical simulation as a way to better prepare our clinicians to deal with injuries and illnesses that we might see here infrequently, but that are high risk for our patients. By bringing simulation to the Valley in the form of a mobile unit, we'll be able to extend the continuum of care and the quality across that continuum.
And this is SimMan 3G. SimMan 3G is a totally wireless and tetherless high-fidelity adult patient simulator. It allows staff to practice their patient care skills. It also gives them the environment to practice those skills safely without the fear of making a mistake. Through the use of radio frequency ID tags, SimMan 3G can recognize drugs that are given to the patient and will also simulate the physiological response that a patient will have to that medication dose. He has pulses, heart rates, breathing, his eyes blink and acclimate to light, as well as many other features to give the staff the realism they need to hone their skills of care and to increase patient safety.
I have had extensive experience with military medics who have been trained with a simulator that essentially simulated battlefield conditions with noise, darkness, smoke, etc. And what I found that the medics that were trained in that scenario were much better in dealing with the crisis rather than a medic who had all these same standard medical training but had not had that real-life simulation. Every time there is an interruption in the patient's care, that can potentially have consequences not only at the time, but also down the road, 1 week, 30 days, 60 days after the time of illness or injury. This is another way to train people's thought process to take away those interruptions so that the paramedic is used to talking to the nurse in the emergency department in a common language that both people understand and used to coming up with a plan. Who do we need down here immediately? What resources might we need in 1 hour, in 3 hours? Are we potentially looking at a helicopter or ground transfer to Denver for this patient, with or without stabilization or surgery or some other interventions? The simulator not only can help with that, but it also helps a lot with team building. It's a lot easier to communicate with someone if you know them, you know a little bit about them, versus just an anonymous voice on the phone or on the radio, which can cause its own communication challenges and frustrations. So I think it's very hard to learn to do such a thing in a classroom. You simply cannot practice those kind of skills by having an instructor give you a verbal scenario.
In many disciplines, from medicine to professional sports to what the military calls muscle memory, the act of repeating a skill over and over again builds competency, which builds confidence. We're able to take situations, subject our paramedics to that clinical environment. They get the experience, they get the reps, so when they actually have to do it on a real patient, they are confident and they are competent.
June 2011, I had a stroke early in the morning. And had we not had at our hospital team training based on sim labs, similar to what they do with pilots and have done for decades, I am the person, because we do not have an existing neurology department, that needed to have people who had been trained to meet immediate needs, who knew where to stand.
The mobile simulation lab will build confidence with our clinical team, ensure patient safety to all of our patients, and enhance teamwork for our Vail Valley Medical Center family and our community.